The Anchorage is designed to perform left atrial appendage occlusion using a minimally invasive approach, also called a subxiphoid approach. Under fluoroscopic guidance, the physician inserts a TUI needle under the patient's xiphoid and processes towards the pericardial sac. Contrast puffs indicate that the needle has not entered into the pericardial space yet. When the needle touches the pericardial sac, the needle starts to beat in synchrony with myocardial contractions. The needle is then moved slightly forward, and contrast media is used to confirm that the needle has entered into the pericardial space. Once in the sac, an O35 guide wire is advanced and the needle is removed. A series of specially designed dilators are progressively inserted in order to dilate the tissue tract. Once the last dilator has been inserted, it is used to place a sheath, which acts as the working channel for the Anchorage procedure. With the sheath in place, the Anchorage is inserted and oriented toward the left atrial appendage, using fluoroscopy or using the available flexible scope. Once the left atrial appendage is in sight, the grasper is used to grab the left atrial appendage securely. Using the grasper as a rail, the snare loop is deployed and pushed toward the base of the appendage. This can be visualized by fluoroscopy. Once the snare loop is at the base of the appendage, the pre-tied suture loop is tightened under transesophageal or intracardiac echo guidance to confirm complete left atrial appendage closure. The legs of the suture are cut using the built-in cutter, and the Anchorage device is removed. The sheath is removed and the skin is sutured. Atrial fibrillation is one of the most common diseases of the elderly. Atrial fibrillation patients are 5 times more likely to experience deadly strokes. Stroke protection in atrial fibrillation patients is achieved by blood thinners or by surgical closure of the left atrial appendage. Unfortunately, warfarin, the most effective and most used blood thinner, carries very severe side effects, and contraindications and studies have shown that a large number of patients are left unprotected from strokes. On the other side, surgical closure of the left atrial appendage requires dramatic open-chest surgery procedures and is only performed when patients require other open-chest procedures, like bypass or valve replacement. The Anchorage closure device is designed to protect atrial patients from stroke and allows left atrial appendage closure without exposing patients to the health risks associated with warfarin treatment and without exposing the patients to very invasive open-chest surgical procedures. The Anchorage procedure is fast, safe, and a definitive protection from strokes for atrial fibrillation patients.